So when you're going to place a tooth or place the sensor behind the tooth, what is going to happen after the X-ray is going to pass through the tooth? The tooth is going to absorb some photons, X-ray photons, block some of the photons, and allow some of other photons to pass. And sometimes it allows all photons to pass depending on which tissue the X-ray has passed through. Enamel, for instance, and metal fillings, metal crowns, ceramic crowns, they will prevent X-ray from passing. So no X-ray photons will reach to the sensor. While dentine, bone, will allow some of the X-rays to pass and then will reach the sensor. Soft tissues, on the other hand, and pulp tissue will allow most of the X-rays to pass. So the sensor eventually will receive different amounts of photons according to the tissue which has allowed the photons to pass, which we call radiolucent, and X-rays or photons that have been blocked by the tissues or materials will not reach the sensor, and hence we will call them radio-opaque. So, and some again in between, like dentine and cementum and bone, because their enamel content, their calcium content is similar, around 60%. So X-rays will pass in different, or will reach the sensor in different quantities. Now this is once the X-ray, we're still inside the patient's mouth, this is covered by a sleeve for infection control purposes. There is no autoclaving here, there is no cold sterilization. It's contraindicated. The only way of infection control is by placing a sleeve. You can place even double sleeves on these, and you place it inside the patient's mouth.